Good morning, everybody. Happy Thursday. This is the Anchorage Emergency Operations Center update for May 6th. A quick reminder that this is being recorded and our PIO staff posted on the OEM YouTube page, Health Department, and OEM Facebook pages as well. So if you missed anything, you might want to check that out. All right, folks, reminder, I think if everybody checked their mail this week, they saw the flyer and kind of cool. We have at the Spinard Food Truck Carnival by our mobile vaccine site, we had some puppies there that you could go and hang out with. And we had those come over to the EOC at the library, and that was kind of fun too. So there we go. And then jumping into the situation report, since the last report, there's 2.3 million additional cases, 41,000 new deaths in the US, 143,846 deaths, 2,356 in Alaska, an increase of 499, which I think was actually from last Thursday. This might be the full week. I'm not sure this was the last 3 days, but one new death, 61 new hospitalizations in Anchorage, 137 new cases since last report, no new deaths, 7 hospitalizations. For 213 resource requests, we have 1,742 filled or satisfied, 3 filled since last report, and 22 continuing to be open and working. In non-critical transport, from the 3rd to the 6th, we had 122, 6 of those being after hours. In our congregate sheltering, we had 380 clients, down 20, non-congregate, 322, up 6, for a total of 702, which is a net decrease of 14. For testing, should first, oh, you know what? I have to apologize, folks. I don't think that's right, but the vaccine numbers, I believe, have been updated. So 19 new doses at Dempsey, 60 at Blood Bank, 21 at Shiloh Baptist, 64 at Diamond Center, and none at the Northway Mall. Weather.
Good morning. My name is Cynthia with the National Weather Service in Anchorage. It looks like it's going to be pretty cloudy today with chances of rain tonight into tomorrow. And then we should have a pretty clear Saturday, and then chances for rain will return on Sunday late into Monday. End of report.
All right, thank you. We'll take that sunshine on Saturday. That'll be okay. All right, operations.
Hey, good morning, everyone. This is Pat Ryder, Deputy Operations Section Chief. Today with Mass Care, our Q&I location has 18 projected discharges through Sunday. That's to include 7 discharges today. Our warming tent will actually be demobilizing tomorrow and is closed today. Hence, we had 0 people over the last 24 hours. With public health, our visit healthcare testing had a decrease of 12.26% over last Wednesday's sample collections. Our 7-day rolling positivity rate average is 1.64%. Our 14-day average reproductive rate is 0.841, and our 14-day average case rate is 12.04 per every 100,000 people in the population. With pop-up testing, we have May 8th at Mountain View Elementary School from 8 a.m. to 7 p.m. Next slide, please. With medical countermeasures, we have some updates with regards to our vaccine week. Thus far, we've administered 1,500 doses given at the municipal-run clinics. We continue to see success with pop-up, drive-up style clinics in highly visible and convenient locations. Our pop-ups at the Spinard Food Truck Festival and Muldoon Library are today. And this weekend, Friday and Saturday night, we have late-night drive-up clinics at the Diamond Center near the Dave & Buster's entrance. This Friday and Sunday afternoon, we have pop-ups inside the 5th Avenue Mall. We have our Saturday clinic at the Hotel Cafe and the Black and Indigenous People of Color event, which will be hosted by the Alaska Black Caucus at the Fairview Lions Park. We are preparing for the authorization of the Pfizer vaccine for ages 12 and above next week. All municipal pods are prepared to begin vaccinating those 12 and above with parental consent. We're identifying convenient locations near after-school activities to reduce barriers to vaccinations. And we are currently coordinating with the Anchorage School District on using school parking lots for mobile clinics. And just a reminder to everyone, we are seeking mobile clinic requests. So to reduce the barriers, we can bring the vaccine directly to your organization, workplace, church, or community center. To request the form, you can access the vaccine tab on the municipal website. Alternatively, you can dial 907-531-5100. Barring any questions, that's the end of my report.
Go ahead, Scott.
Good morning, everyone. This is Scott Carpenter, your friendly neighborhood logistics section chief. Here's our lines of effort as we continue to support mass care operations with the transition over to their new location, as well as the summer shelter and services requirements, and the wrap up of the Fairview Rec Center and warming tent locations. For medical countermeasures, again, another transition to their new location. The pre-planning for their second vaccine week, as well as any additional requirements for vaccination sites. And for the rest of the EOC and AHD, we continue to work staffing and support to the Northway Association events lined up through the summer. Pending any questions, end of logistics report.
Thank you, Scott. Finance.
Good morning. This is Carrie Wiedeker, the EOC's Finance Section Chief. Currently, we have encumbered $19,801,184. Our actual spent to date is $646,236 for a total of $447,421. Please continue submitting invoices and supporting documentation to eocinvoices@anchorageak.gov. The Office of Emergency Management continues to seek cost recovery by way of FEMA public assistance. For additional information, please contact Aaron Zachary. And finance plans to continue to support operations as they transition to other parts of the municipality. End of report.
Thank you, Carrie. Safety.
Good morning. This is Annalisa Roberts reporting out for safety. While we're still dealing with the COVID pandemic, disinfecting is still a good practice to have, and I appreciate everybody continuing proper hygiene when they're out in public, in their homes, and in the workplace. However, it is a good option and idea for workplaces to have a safety data sheet on hand. That is just a form that includes the chemical, the physical health and environmental health hazards and protective measures of these products that you're using. If it's for personal use only, meaning having just your own hand sanitizer on your desk for personal use, you don't need to have one. But if you're asking employees to disinfect the common areas of their workplace with Lysol, Clorox wipes, anything, it's a good idea to have that so you know what chemicals are being used and what's on hand. So you don't have people using bleach in one area, ammonia in the other, Lysol in another. And also if somebody has an adverse reaction, they know what chemicals are being used. So when they get treatment, they can tell their doctor and they can get help for that. So it's good to try to limit what's being used and just having one or two different products on hand, making sure you have the data sheets so you can protect yourself from any claims for OSHA if they did come in, but also you can keep your employees safe and healthy. End report.
Thanks, Annalisa. Public information.
Good morning, everyone. This is Heather Orono, Deputy Public Information Officer at the EOC. And as you saw a few slides back, we are having a variety of events happening for Vaccine Week. We are also doing whatever we can to help just get the word out about Vaccine Week as part of the Sleeves Up for Summer campaign. We're holding vaccination clinics at different times of the day just to try to make it a little bit easier for folks who might not have a standard schedule. We also were sure to put something out yesterday in celebration of Cinco de Mayo, just reminding people to celebrate safely and to continue to wear a mask. We're also working on sharing information about the federal government's new ways to find vaccine clinics, which include texting your zip code to get vax in English or vacuna in Spanish, so that if you take part in that, you can get information about 3 vaccination clinics near you. And as always, you can go to anchoragecovidvaccine.org for a full list of all of our available vaccination clinics. And we are also continuing to reach out to community members and groups about testing, vaccination appointments, and resources. Thank you.
Thank you, Heather. Liaison.
Good morning. This is Celeste Prescott, Liaison Officer for the Anchorage Emergency Operations Center. I'd like to thank all of our partners that were able to join us today. Does anyone have a report out at this time? Okay, hearing none, we'll go right into the hospitals. And Alaska Native Medical Center was unable to join us today. They have 8 positives, 3 in the ICU, 1 on a ventilator, and no PUIs. I believe Sean is on with Alaska Regional Hospital.
Alaska Regional Hospital has 6 positive COVID patients, 3 in the ICU, 2 on vents, and 3 PUI this morning.
Awesome. Thanks so much, Sean. And Providence Alaska Medical Center, were you able to join us today?
Yes, this is Nikki Holmes from PAMC. Today we have 8 COVID positive patients, 1 in ICU, no on mechanical vents, and 7 COVID recovered. Thank you.
Thanks so much, Nikki. And is anybody on for the 673rd Medical Group?
Yes, good morning. This is Sergeant Perez with the 673rd Medical Group. Reporting our vaccine numbers. As of yesterday, we have administered a total of 16,514 vaccines, 8,878 of those being the first dose, and 7,636 being both doses. I will put these numbers in the chat just so that you can have easy access to that, pending any questions and a report.
Thank you so much for that. And that's very convenient to have them in the chat. We appreciate it. And Kara with Mat-Su Regional Medical Center was not able to join us, but she is reporting out 11 positive cases, 5 in the ICU, 4 on ventilators, and 0 PUIs. And that's all for Liaison. Thank you.
Thanks, Celeste. And last but definitely not least, Incident Commander Loach.
Hey, good morning, everybody. This is Amanda Loach reporting out for the Incident Command. As Vaccine Week continues, we do see on the front page of the ADN our neighbors in the north in Fairbanks having an outbreak with rising hospitalizations of younger patients ages 18 to 40. Younger people also reporting there that younger people tend to stay in the hospital longer to fight the virus off, and staffing is an issue there. Low hospital capacity affects everyone, and that might need higher care in a community. On a lighter note, Montana tribes are also reporting they're gifting vaccines to First Nation neighbors in Canada, and also that Governor Dunleavy has offered vaccine to residents in British Columbia as well, our neighbors, and hopefully that will tend to ease our relationships with our neighbors there to access the vaccines that we have access to. We continue to move forward with our vaccines here in Anchorage, and we are on the lower end of the high-risk spectrum. We have 50.5% with vaccine series complete, which is great, and 57.7% of eligible residents receiving at least 1 dose. So that is great progress there. Please do keep up the good work. We appreciate all of you tuning in and participating and working with us. Try to get some rest this weekend, and please reach out to us with questions, information requests, and any requests for support that we can offer to you. Thank you, everyone. Have a great weekend.
Thank you, Amanda. And not a question, but Brenda did have a little note in here that Walgreens and CVS have started to take walk-ins and no appointment for their vaccines in other states, and hoping that will end up here soon. Question, when does it look like the earliest time that 12 to 15 will be announced? Question, Monday.
So this is Janet. What I know about that is that the ACIP is supposed to meet on Monday, and then I think the CDC has to do something after that meeting. So we're expecting probably like Wednesday, but it could be, you know, as early as late Monday or Tuesday that the approval would be announced.
Thanks, Dr. Johnston. And Nikki Holmes put in a comment here that Providence might be sending 6 ventilators to Fairbanks if they don't receive them from the state. So thanks for helping out there, Providence. Any other questions this morning? Yeah, okay. That sounds like it. Our next meeting is 10 a.m. on Monday the 10th. Look forward to seeing everybody then. Everybody have a great weekend. Thank you.